So, for someone stuck in a cycle of pain or slow recovery, what are some of the biggest mental or emotional barriers that can hold healing back?
I believe the emotional barriers is um, significantly falls in our back as providers. I don't think they were provided with the explanation. I don't think they were provided with the hope that we need to give them. I don't think we provided them with the why you're having this pain. I looked at myself and my practice a few years back, and I decided, okay, we're really doing a shitty job in this. You've got shoulder pain, you need surgery, you need a cortisone shot, you need this, right? The patient doesn't know why, what's causing, what the results, what the plan, right? So we basically stripping them from the hope that they will get better or somewhere back to a normal lifestyle. I think that falls on us. So that's one of the barriers, the loss of hope, feeling that they are alone in pain. Remember something. I always said that to my patient. Pain is the only thing that we cannot really measure. It's not like blood pressure. You put a blood pressure machine and you measure it, or your heart rate, or your breathing, or even the brain scan. No, it's still primitive in scale from 0 to 10. Where is your pain? And it's quite subjective. You know what I mean? So you would say that my pain is 10. I look at you and you're drinking your coffee. I said, yeah, you know what? It's not 10, it's 5. So this gap, right, make us as a provider slip away. So I think the patient need, number one, to be understood, get their hope back, understand what they're doing, what's the plan. I even tell the patient, I don't have an answer, but I will try to get you an answer. And if I don't get an answer, tomorrow will probably there will be an answer provided. I have a lot of patients that I said, you know what? I don't think the surgery is good for you. Let's continue working together, and maybe in few months something will come that will help you out. And sure enough, we're using now stem cells and PRP and other stuff, right? So hope is very important. Plan is the second thing. Number three, I think, is the drive. We need to understand and customize the pain treatment for the patient. When I did my shoulder surgery, Lee, they spent an hour with me. I went to Colorado to an Olympic team surgeon. He spent an hour with me. An hour. I didn't have any pain. I just did an MRI looking at an old injury, and the shoulder was slipping, the bone was slipping away from the joint, and they looked really bad. And so I sent it to one of my colleagues. I said, yeah. He called me 5 minutes later. Said, when are you coming for surgery? I said, hang on. I'm not ready for that yet. I've been postponing it for 15 years because I don't want to take the time to recover, which I know it's going to be a lengthy one. I went to that doctor. He spent an hour. What you want to do? I said, I want to go back to lifting weights. I want to compete in lifting weights. I want to be able to play squash again. I wanna be able to play with my kids. We do martial arts. I used to box, and all this. And sure enough, he designed the surgery for that. And instead of putting one anchor, they put four anchors. They did a certain stitch so the muscles wouldn't rip off again. They cleaned the muscle, cleaned the joint, moved my biceps out of the way so it wouldn't impinge on the other muscles. But he designed this. The other surgery that I was offered by my colleague was just fixing the muscle and putting it back. I would have probably ripped it off in the first 3 months trying to lift weights, right? So putting all this together and customizing it for the patient understand that they're valued. They are, we're not handing them a treatment plan. They are partners in their healing process. I think all this affect the mental health. I think all this um, affect their mental rehab before the physical rehab, in my opinion. And I've seen great outcome doing that.
If this sparks something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify or listen on Apple Podcasts. Like, subscribe, and stay connected for more.